All right, today we're going to tackle a topic that's super common, but honestly, pretty misunderstood: vaginitis. Our whole goal here is to just cut through all the noise and give you a really clear, straightforward look at what it is, what's behind it, and how it gets figured out. So let's just dive right in.
Right? So many of us experience this at some point, but what's actually happening inside the body? The thing is, it's not just one thing, and getting a grip on the different causes is really the key to understanding the condition itself. We're going to demystify it together.
So, at its very core, vaginitis is just inflammation. But here's the crucial point: it's an umbrella term. Think of it like a big category. And underneath it, you've got several different conditions, and each one has its own unique cause. To help make sense of it all, it's really useful to split vaginitis into two main buckets. In one corner, you've got primary vaginitis. This is when the problem is caused by an organism that's directly infecting the vagina. And in the other corner, you have secondary vaginitis, which is when the issue is coming from an outside source or maybe spreading from a nearby area of the body. Think of this as our roadmap for the next few minutes.
Okay, let's start with primary vaginitis. What's really fascinating is how the most common causes can actually change throughout a person's life. This whole journey can start as early as childhood. During this time, there's a specific type called vulvovaginitis that's most common, and it's often linked to totally different things, like hygiene or different irritants, than what we usually see in adults. But let's be honest, the types we hear about the most, they tend to show up during the reproductive years. This is really when we see the big three causes of primary vaginitis emerge. First up is the Trichomonas infection. This is caused by a tiny single-celled parasite that makes it biologically a whole different animal from the bacterial or fungal causes that we're going to look at next. And check this out. This is exactly what we're talking about. This is a micrograph showing trichomonads. You can actually see the little tail-like things, they're called flagellum, that help them swim around. It's kind of wild to see the actual culprit up close like this. Okay, next on our list of common primary causes is Monilia infection. Now that name might not ring a bell, because you almost definitely know it as a yeast infection. Yep, Monilia is just another name for the Candida fungus that's behind it all. And there it is. This slide shows Candida right under the microscope. You can see those branching structures. Those are called hyphae, and the little buds. This is the classic signature of a yeast infection on a microscopic level. The third major player is Bacterial Vaginosis, or BV. Now this one is different. It's not about some external invader. This is all about an imbalance. It's what happens when the naturally occurring good bacteria are just outnumbered by an overgrowth of other types of bacteria. And when we talk about BV, we have to talk about something called clue cells. This picture gives you a first look. They're a major hint for doctors. And don't worry, we are definitely going to circle back to what exactly makes them a clue in just a bit. And to kind of complete our trip through the primary causes at different life stages, we look at the postmenopausal years. At this point, changing hormone levels, specifically a drop in estrogen, can lead to a condition sometimes called senile vaginitis, which totally alters the vaginal environment and its natural defenses. Okay, so that covers the primary causes, the infections and imbalances that start right there. Now let's switch gears to our second category, secondary vaginitis, which is all about those external influences. So what kind of external factors are we talking about? Well, it could be an infection spreading from nearby areas, like the urinary tract. It could also be mechanical irritation from something like a tampon, or even chemical irritation from products like douches. And sometimes it's just a case of your body's overall resistance being low, which makes it more vulnerable. It really just goes to show how interconnected all our body systems are.
Now that we know all the potential causes, how do doctors actually figure out which one it is? It's kind of like detective work. So let's use bacterial vaginosis as our case study to see how this clinical investigation really happens up close. For BV specifically, there's a really clear diagnostic tool that clinicians use, and it's called Amsel's criteria. It's pretty much a 4-point checklist they use to confirm a diagnosis.
So to get a diagnosis, a patient needs to meet at least 3 out of these 4 criteria. A doctor will look at the discharge, they'll check the vaginal pH to see if it's higher than the normal 4.5. They'll perform that very specific test with a memorable name. And finally, they'll look for those clue cells we mentioned under a microscope. And yep, here's that test. It's called the whiff test. And it's exactly what it sounds like. A sample of the discharge is mixed with a drop of a solution called potassium hydroxide, or KOH. And if it produces a distinct fishy odor,
That's a positive test, and one more check on the list.
Now, this is the really cool part, the direct comparison. This is the visual confirmation. On the left, you see normal, healthy vaginal cells with clear, sharp borders. Now look to the right. Those are the clue cells. See how the edges look fuzzy and kind of blurred? That's because they are literally covered in bacteria. This is the clue that gives BV away under the microscope. So, after looking at all the causes and the diagnostics, what's the big picture here? Well, it all comes down to one central theme.
And that brings us to the really crucial takeaway, balance. Whether we're talking about a fungus, bacteria, or parasites, all of these conditions are ultimately about a disruption to a very, very delicate ecosystem. Looking at these healthy cells again just reminds us that the goal is always to maintain or restore this natural, balanced state. We've seen that identifying the specific cause is absolutely the first step toward fixing the problem. But it kind of leaves us with a bigger question, doesn't it? Knowing what we know, what are the best ways to actually support and protect this incredibly important, delicate ecosystem?